Safeguarding the health of Pacific Islanders is a priority, and in the region, a collective approach is taken to tackle common challenges. From the onset of the pandemic, Pacific Island countries and territories had been vigilant with their efforts towards COVID-19 preparedness and response. Because our Pacific health sector is fragile in the region, development agencies, partners and donors coordinate and work together to support Pacific Island countries and territories and their needs for a strengthened approach towards this pandemic. A joint incident management team was established.
We were facing a new virus, lots of unknowns, and Ministries of Health of the Pacific needed some support to be able to respond effectively to that. Many countries didn't have testing capability at that time. We were all learning about the virus and what would be needed to respond. And so a number of partners came together under the Joint Incident Management Team to collectively support the Pacific in that response and join resources and capabilities that no one agency would have on its own.
With established networks around the region, the Pacific Community's Public Health Division took lead to reach out to member countries.
Before COVID-19, there was a similar pandemic in which the partners realized that they needed to strengthen each of the countries' ability to be able to prepare for such a pandemic like this. Having said that, COVID-19 pandemic exposed the fragility of some parts of the health system, and it provided the opportunity for all partners to concentrate their efforts on building more resilient health systems.
The European Union, the World Health Organization, the United Nations World Food Programme and the Pacific Community signed an agreement to strengthen their existing partnership to support health sector responses to COVID-19 across the Pacific. The agreement has 5 main outcomes, including increased readiness of countries for effective COVID-19 response operations with a special attention to those living in vulnerable situations, strengthened ability to test, detect and monitor for COVID-19 presence in partner countries, reduced risk of spread and excess morbidity and mortality from COVID-19 and other health issues, improved collaboration between environment, animal and public health sectors, and an efficient logistics and delivery mechanism for COVID-19 response. The European Union committed over $24 million to strengthen COVID-19 response and preparedness in the region. 13 Pacific Island countries and territories were provided support under the EU COVID-19 project.
Well, we recognize that the COVID-19 crisis is a global pandemic, therefore it requires a global solution and a global response. Our response for the Pacific has been, I would say, twofold. On the one hand, we wanted to address the socio-economic impact of the pandemic, because even though in the first stages of the COVID-19 crisis the Pacific was spared, it still had to face the full brunt of the socio-economic impact of COVID-19 with travel and other restrictions in place. So we redirected 120 million euros of our assistance to respond to the socio-economic impact of COVID-19 in the Pacific. Then, of course, it is a health crisis, so we decided also to address the health dimension of COVID-19. And in so doing, we mobilized funding in the tune of 22 million euros to address the medical consequences of COVID-19 in the region.
This allowed the establishment of the Pacific Humanitarian Pathway on COVID-19, a regional coordination platform set up by the 18 countries to facilitate timely and rapid movement of medical and humanitarian assistance across the region. But as borders remain closed due to national travel restrictions, the World Food Programme provided much-needed air transport to reach countries in need of urgent assistance.
We have set up the Pacific Air Service to support the countries in the Pacific region, our sister agencies from other agencies of the NGOs, our partners, the NGOs, but also the donor governments in terms of transporting medical, and sometimes not only medical, but other supplies to the countries.
These connections and partnerships enabled SPC and other agencies to help member states prioritize areas of assistance.
And so we looked at which countries needed more resources, training and support within the health workforce, and that was depending on their responses to the survey. That's how we were able to see where the need was. Countries such as Fiji had a lot of resources and the health workforce was more. And so when we looked at it, they did not need so much as our smaller member countries such as Kiribati, Tuvalu, even countries like Vanuatu and Solomons. There was still a lot of gaps and challenges within their system that we needed to provide as well.
As COVID-19 eases off in some countries in the region, the WHO warns that it's no time to get complacent.
We need to be preparing while we're responding. That's one of the core approaches for WHO, especially in this region. Even while we're in the midst of the emergency response, we need to be preparing for what may come next. And so I think that involves investing in a whole range of areas at the country level and at the regional level. We've seen countries that had almost no PCR testing capacity several years ago now have multiple testing labs around the country. We have the capacity to do whole genome sequencing developing in the region. So there are technical capacities that are expanding, and I think we need to continue to do that while also just investing in health systems. I think that's universal healthcare is the most important element to all of this, making sure that we have strong foundations on which to build a response.
The Pacific Community, World Health Organization and the World Food Programme are confident that the Pacific Island countries and territories are now better prepared for any future pandemic.